So today you probably heard we were doing a little walk-up clinic up at the convention center. We had about 560 doses left over from last week, and those have all been dispensed. So I think that happened a little bit before 1. So we are out of doses for today's walk-up clinic. So that was a success. We didn't have to waste any doses. They all went into an arm. So that is good news. This week, we're going to host 2 initial dose clinics. One will be tomorrow, Wednesday, the 10th, and then we'll have another one on Thursday, the 11th. The times are the same, 7:30 to 4:30. We are signing up for those on our new scheduler. And so as of last check, there are still plenty of open slots available for both tomorrow and Thursday. So you can go to abilenetx.gov/vaccine schedule and sign yourself up. Again, just a reminder to those adult children or grandchildren of the elderly to please help your loved ones. You can do it over the phone with them as long as you have access to the internet. You can sign them up. So even if they have previously signed up on our waiting list, we're encouraging you or them to go ahead and sign yourselves up again on this. This actually reserves you an appointment. So it's not a wait list, it is an actual appointment. The time slots might have confused people last week, I think, because we had everybody showing up at the very beginning of that time slot, which at each window, that creates a little bit of a backup on the line. So we've scheduled starting like 7:30 to 9:30 is the time frame. Not everybody needs to get there at 7:30 because that creates a really long line. And so those who came last week, and what we're finding also is that people are coming outside of their appointment time. That just creates those longer lines. So if you schedule an appointment time later in the day, please honor that appointment time. We've kind of talked about, do we need to go ahead and just have people who don't have an appointment at that time slot step out of line and allow those other people to come up? Because it does create a longer wait time for those who have an appointment scheduled for the 7:30 to 9:30 appointment time frame. So just a heads up, I did hear a lot of people say, well, I thought I would avoid the line by getting here earlier, but that actually creates the line. So it's actually better strategically, if you're trying to be strategic, show up a little bit later in your appointment slot. So if you are from 7:30 to 9:30, you might show up at 8 or 8:30, even closer to 9. You won't have much of a wait then as you will if you show up like before 7:30 or at 7:30. So just a little insider tip, if you want to try to avoid the line, that would be super helpful and less frustrating. So we also are going to be sending out the OneTime Use Link. We've got a group of people identified. We've downloaded into the right format. We're going to try sending out that OneTime Use Link to some of the people that are on our original waiting list to see how it goes. We anticipate that because it cannot tell what's a cell phone and what's a landline, that there may be some that don't actually get delivered if you did not give us your cell phone number and you gave us a landline. So that'll be a little bit of an issue we will need to work through. It's also going to send an email simultaneously, but it will be one link per person. And so whether you use it on your text or whether you use it on your email, it'll be a one-time use link per person. If you receive that link and you have already received your vaccine, or say you've already secured an actual appointment through our self-scheduler, then it is fine to go ahead and forward it to someone else who does qualify. Ideally, if you know somebody who has signed up on our original wait list, it's not going to be unique to you. It will just be a one-time use link. So you could forward that over to someone if you yourself do not need it, someone else who does qualify. They're still going to be screened with those questions about whether they qualify in 1A or 1B. But it's just another way to attempt to get more people signed up. So once you make it through where you actually have to select your appointment time, even if you end up not confirming that appointment, once you get to that screen, it's going to be considered used. And so if for some reason you have to get out or you stop and go back or whatever, it's not going to allow you to use that link again. So just a heads up on that. So one of the other things that people are noticing when they get there, because they are going through the self-scheduler and it's going through the screening process and they are entering all of their information, when you arrive, you are also having to fill out the actual paperwork in person. And the reason for that is we are not fully paperless yet. We have not received all of the iPads needed in order to do away with that written paperwork. So it is time consuming, and I wish it were different. I wish we had everything ready to go, but we didn't want to delay the self-scheduler to wait for every piece to be implemented. So you will still need to fill out that paperwork again. It's going to ask you for the same questions. So if you'll just bear with us, hopefully within the next week or so, we'll receive all the iPads, and that way it will completely eliminate the need for people to come in and fill out that paperwork. So just be prepared for that. I think people are surprised and frustrated, like I said, because they're having to answer the same questions again. So this week, as you all are aware, Texas added all of the school staff and the child care workers to the eligible list to be vaccinated now. So we have changed our screening to include that when they go in and schedule themselves. We did get some from DSHS this week that it does not include the colleges and universities yet. So just FYI, that is specifically for the pre-primary, the primary, and the secondary school systems, and then your licensed child care facilities. We've also had some questions about if someone watches children in their home, but they are not licensed, they are not included in this. They are licensed child care facilities or home child care centers that are licensed. So another clarification for who is eligible. As of today in Taylor County, there have been a total of 24,746 vaccines distributed within our county. So that does include the 560 that we did this morning. That is a total between all of those who are immunizing. Another thing that we've been hearing is that people are concerned that they won't be able to receive their second dose, that it may not get shipped. The state has changed the process on that, and so they are automatically shipping second doses when they are due, instead of waiting for the locations to request the second doses that are due. So people don't need to be concerned about being able to receive their second booster dose, as long as you keep that appointment. And there are some times when life happens, you're going to be out of town, you may find yourself sick that day, those kinds of things. We just need to communicate that, and you could just call the health department, get your name added to a list. We track those, and as we have subsequent clinics that we have availability for, we will reach out to those people for their second dose. So you want to just keep in mind that ideal time frame for Pfizer, it's the 3 weeks, but you can get it up to 6 weeks after your initial dose and still be considered within that target window. Even if you have to wait a little bit longer for some reason, you're going to be out of the country or having surgery and your doctor has advised you to wait, you can still get it as soon as possible. So that doesn't mean that you have to start the series all over again. If you get your first dose from us, you actually leave the clinic with your second dose appointment on your card. So you want to make sure that you hang on to that card Another helpful tip is to just snap a picture on your phone of your vaccine card. That way, in case you lose it, you don't have to try to figure out when your appointment was. You've got it on your card. Another thing that people are doing is forgetting their card when they come back for their second dose. So we do provide another card, but it's only going to have that one dose on it. So what you would have to do when you get home is you would just have to add your second dose to your first dose, just transfer all that information over to your other card. If you want to just have one immunization card, it's fine to keep it on two. It's totally up to you, not necessary if you don't want to. But again, I would just encourage you to snap a picture if you've got to. Snap a picture of both or combine the information, snap a picture of that one, and that way you've always got it with you. Let's see. Statewide update, there have been more than 4 million people that have received at least one dose of their vaccine, and there are now over 2.2 million people within Texas that have been completely vaccinated. So the population of Texas, I think, is somewhere just under 30,000, 29 million. So you can do the math on the percentages there. Making headway, but still not anywhere close to where we want to be to feel a little bit more comfortable. So
I had a question, Annette.
Sure.
So for the public clinic, why was it that we were able to go off of tier 1A, 1B certification? Like, was there a special request done for that? I've seen a lot of counties have been doing that.
The Walkup clinic, though, we did not screen for eligibility at this one because we had doses that were going to expire if we did not use them today. So the state has said that if you have doses that are coming up for expiration, that you are to find a willing arm to put them in instead of wasting those doses. And so we were not confident that we would have enough people who were actually eligible to respond quickly enough. And so we opened it up to anyone and everyone. We did actually have quite a few people that are eligible anyway, that were able to come, but that's what the state authorizes if you have doses that are set to expire.
Okay, so then as far as like the waiting list goes for people who were on the list, are they going to feel slighted in any way by this, or does this not go over that?
I'm sure there will be, but when you're in a situation from a vaccine administration standpoint, people will say, well, why didn't you call me? Well, I don't have enough staff. I don't know who you are. And so to quickly enough I've mentioned this several times, but it takes my staff about 700 outgoing phone calls in order to schedule 200 people. We don't have that kind of time when you're looking at being able to use doses within a certain amount of time frame. And so I don't think that was reasonable. So yeah, I'm sure that, it's not ideal. It's not what we wanted to do. But it is better than throwing all of those doses in the trash and then no one gets them. So vaccinating people who weren't necessarily eligible, it does help everybody in the long run. I mean, we still got additional people vaccinated. Those people are going to be around elderly people, at-risk people. And so it does still provide some community protection. And from a public health standpoint, you remember that our patient is the community. It's not just one individual. The patient for public health is the community. And so it was a public health strategy that was still very effective, but unfortunately it did skip people who had been on a wait list. And that, again, not ideal, but still important.
And so then clinics like this that'll just be walk up, no screening, are only going to happen if we have an excess that's going to expire. So it's not really something you can plan for, or do you know if there will be a time that we'll have any more like this? Will we?
That's right. So we didn't plan for this one. We didn't plan to have extra doses, but if you'll remember, we received 2 weeks worth of vaccine in 1 week because of the snowstorm. And so we had over 7,000 doses, well over 7,000 doses that we needed to administer within that time frame. And so I think just kind of that perfect storm, literally and figuratively, happened to where we were left with those extra doses. But we anticipate that that won't happen frequently.
Okay, thank you.
Mm-hmm.
Annette, you can hear me, right?
Yes.
Cool. One of the things that we always talk about is that we don't want any of these doses to go to waste, right? And I'm looking at the Department of State Health Services report from last week, and it says that the Abilene Taylor County Health Department, you guys only wasted one dose, and then today you gave away these 560. I mean, what does that say about the work that your people are doing?
I think that they are excellent at managing doses. They have taken great care. They take their jobs very seriously. Our director of nursing, Carrie Waller, is an excellent manager of that vaccine. So there is a whole process that has been developed to track doses when they were drawn up, when they were put into the refrigerator. Those go out first. That one dose was actually a dose that within the bays, as they get distributed out to we have 30 different bays that we have vaccine administrators operating from. One of the doses had fallen down underneath the table and was kind of under the curtain. And so at the end of day, when cleanup was happening and people were picking up, they noticed that one dose. And because there was no way to tell how long it had been there, was it there from the day prior? Was it today's? We had no idea. And so instead of risking putting that in an arm when it could have been, well past its expiration time frame, we chose to waste that instead of taking a chance. So that was the one little thing that happened. But overall, I am very proud of staff that we have wasted very little vaccine. They're all going in arms.
And so talking about not wasting vaccines, I think Noah kind of touched on this earlier, but there are other counties who are already vaccinating people in 1C. Odessa is the one I can think of right now. Is there any plans for Abilene to do so, or have you gotten any guidance from the state?
We take our guidance from the state. So they opened up the new eligibility criteria that they released this last week for teachers and childcare workers and school staff. And so we're being diligent about following the state's plan. So at this point, we don't have any plans to open it up further until we get guidance that says that from DSHS.
So just to clarify, so I guess, are they not following what the state's saying?
I will not speak for anybody else because I don't know their reasoning behind it. I know that the state also asks us to try to incorporate and include people that don't have access to signups. You have to consider people who may not have access to healthcare. So when we're asking people, have you been diagnosed with a chronic illness? And you've got people who don't have healthcare, who don't have any way of knowing what their health status is. Are they focusing on groups like that? I don't know. So I don't want to speak to anybody else's method for how they're distributing. And I certainly wouldn't assume, one way is better than another.
Following up, do you think all like the residents of the nursing homes and other long-term care facilities have gotten all of their doses? Have those people been, that's the most at-risk group? You think they're vaccinated?
All of the ones who wanted it have received those doses. If they're living in a long-term care facility, they've had access. And so I can't tell you what percentage that is because I don't know how many people turned it down, but it has definitely been offered to everybody. And if somebody knows of somebody who has not received it for whatever reason, they can certainly let me know. And we've worked early on to prioritize that group of people. So we can certainly look at how to get them a dose, but I believe that everybody who opted in got it.
Okay, one last question. What do you think is the reason for the drop off in new cases? Are we getting to herd immunity yet?
Well, according to the real experts, no.
Okay.
So I just repeat what the real experts say usually, but they are not comfortable saying we've reached herd immunity. Is there some protective factors from those who have been vaccinated? I would say absolutely. So I would hope that that is part of it. Yeah, I honestly don't know. We've had, people who have had the virus, people who have been vaccinated. And so those numbers total, does that provide enough of a protective factor in key areas? Potentially. I just don't know how to speculate. I think we could all kind of speculate based on, we assume that is happening. But we also know that testing has gone way down. I don't know whether that's just because people are not having the symptoms and not having a reason to go get tested. That's another question too, that I don't know that we'll fully know that answer. So it may be a combination really of everything.
Hi, Annette. So I
Hey.
wanted to ask, the CDC has released new guidance about how vaccinated people can function and move about and the experiences that they can change. And I was wondering if you had any thoughts or responses to that.
So I did see that it was, it's very limited guidance for those people who have been fully vaccinated to gather together indoors and kind of continue on. I think the problem with that, I don't think at this point as the health department that we're ready to say, okay, everybody can kind of go back to their normal lives. You can gather indoors. I think there's absolutely a way to be safe about it. If you are going through the process of ensuring that those people that you're gathering with have been fully vaccinated, or maybe even had the virus within the past 90 days, we think that there is a protective factor based on that. And so I think there's a responsible way to do it. These are things that families have to decide for themselves. Those are decisions that, of course, we in Texas, we love our freedom and we love to make decisions for ourselves. And I think it's our role to make sure that people have the tools and the information they need to do that responsibly. But as a health department, we're still encouraging, we want to err on the side of caution. We want people to continue to be mindful that not everyone has been vaccinated, especially if you have elderly loved ones or at-risk loved ones who have not been vaccinated. You still need to be very careful about what you expose yourself to if you're bringing that home. And so for those people, it is very, very important to continue to be diligent, but it's also important for the rest of us to be diligent as well. I think it sends a message, when you go into a place, there are people who are still very uncomfortable and they want to wear their mask, even though the governor's mask mandate is going to be lifted tomorrow. I think that it's important, if we all do value freedom, it's important for those who don't feel comfortable yet to be able to continue to wear their mask and, not feel, segregated or ridiculed by doing so. I think it's a personal decision for everybody, and we all need to be respectful of that. But I think it is important to continue to do that until we get a little bit further within the vaccination game. But again, those are personal decisions everyone will have to make. Just need the tools to do that well.
If I can jump in, Annette, this is the week has been one year since, the pandemic first kind of hit really hard here. Can you kind of reflect on, I guess, the past year and, where we are now and where you see us going?
Well, I think we've come a long way. We've learned a lot. I think that, it's really just been incredible how much we've all relied on each other. I think we see how much divisiveness there can be portrayed in the media and social media. But I think from my end and my perspective, I've seen more people come together and rally around kind of the same cause. And so from my perspective anyway, it's really been just awe-inspiring to see how well our own community has come together. Had so many offers, so many kind emails and offers from organizations and community partners to help public health and the hospital with anything and everything that we've needed. And so I just think that that really is my biggest takeaway from all of this, is that we really do have everything that we need within our own community. We've all relied on each other, and I think it's really paid off. I think we've fared much better than many other communities in terms of just, I guess, disease burden, and then maybe even partially, hopefully, economically, where a lot of businesses and people have just rallied around each other to try to lift each other up. And so that's been very encouraging and probably my biggest takeaway.
How does it feel knowing that a year ago, we were still kind of dealing with, figuring out what this virus would be, and now we have like nearly 25,000 people vaccinated?
Yeah, we look back on it and we knew absolutely nothing when it first started, had no manual that we could go to for best practices where we could say, okay, here's what we need to do. So basically learning as we go and finding out new information every day, ensuring that the public had that information. Certainly a very fast and I would say a whirlwind of a year. And pretty glad to have it behind us, looking forward to the future where we can get past this and hopefully do things, some of the things that we're doing now, I think will benefit us just in terms of general infection control, I think have been helpful. I think we can do much better as a community as well in that area, but glad to have it behind us. Almost completely behind us, hopefully.
Annette, you talked a bit about the Inoculate app, and now that we've actually gotten to see it and use it, how is it working? Is it taking some of the load off that we were facing before?
Yeah, it's been working really well. I'm anxious to get the other piece of it implemented. So it will eliminate the actual paper that we have to manage on site. And then it completely goes where the vaccine administrator enters the information about the lot number and the vaccine and who it was given to, and that will communicate all of that information directly to the state. And so it eliminates the need for my staff to go in and do manual data entry, which is on the back end. That continues to happen, 24, even sometimes 48 hours after a vaccine hub, you've still got the remnants of tying up all the loose ends with that data entry. And so we'll be doing mass data dumps to the state. So again, as much time as the self-scheduler saved staff, I think an equal amount of time will be saved on the back end just by not having to do manual data entry. So really looking to close the loop on implementing the rest of it. Be exciting.
So then now actually seeing it in person, in practice, would you say it's living up to what y'all were hoping it would do?
Yeah, absolutely. I think there are a few tweaks that we've been working with the vendor to make it just a little bit better, but very minor things. And so I would say it's definitely lived up to our expectations.
Thank you.
Hey,
At
Annette,
one point, sorry, go
gonna
ahead.
And is there going to be any future clinics on the weekends or in the evenings?
So we've talked about it. The hardest part there is getting enough volunteers and enough staff to be able to do those. So I'm not against it. It would just take some finagling and some doing. We've got with the non-clinical volunteers, the city of Abilene has been providing the majority of those volunteers. And so every department is assigned a number of staff that they have to allocate towards the hub every clinic day. And so if we operate outside of normal business hours, you're looking at potentially having to pay overtime, which I know would be a little bit of an issue for the city to pay that much overtime to the staff employees. But then also you've got our immunizers. And so it would just completely depend on who is available, if we had enough people to make it worth it on a weekend. But I think it's certainly something that we've talked about and we're willing to do. It's just that we've had so much good response for the weekdays at this point, and haven't really had a ton of requests from people to do a weekend. So I think we would just have to look at it and kind of weigh the pros and cons and see if there was that much of a need for it.
Annette, at what point will the health department stop calling people off of that wait list and just depend solely on the online scheduling tool?
So our goal is I mentioned that we were going to send out the OneTime Use Link. So our goal would be to get through everybody on that list, to send them a OneTime Use Link, or attempt to. There are some people who only left us a landline phone and did not include their email address. So we will still make that attempt once we've sent out that OneTime Use Link to everybody on that list, then we'll stop operating off of it. Okay. Thank y'all.